because in some countries like Thailand, for example, there's already quite enough knowledge about what strategic purchasing is and how it's being implemented in some health financing schemes already. But in some countries, just hearing the word purchasing can be very politically sensitive. And so it was a bit hard for us to even get our foot in the door and try to build the connections with stakeholders and explain the topic and explain how it can just be a potential health financing tool to save on resources and make the health system more cost efficient. So that was one challenge that we had about strategic purchasing as a whole. In terms of adapting and applying the framework, so one challenge was that countries did have different names for the same thing. So whether it was how they referred to the tax-funded scheme, whether they called it the state budget or some other name. So we did have to make sure that we were consistent with that. Some countries also had very different, so Southeast Asia is a region with very different health systems. So for example, Brunei is almost entirely tax funded, so there isn't really a purchaser-provider split. And therefore, when we were having conversations about strategic purchasing, there was a very different focus from countries that do have a purchaser-provider split. So some countries felt that, for example, looking at procurement and making the procurement of goods for hospitals was maybe more relevant to them, whereas other countries like Thailand or the Philippines are really looking as a whole about how to make their health financing schemes more strategic and how to purchase services from different healthcare providers. So kind of framing our work according to each country's priority was a bit of a challenge, but we also knew that it would be necessary because, again, Southeast Asia is a region with very, very diverse health systems, very diverse demographics, population sizes for each country. So that's why we were conducting a regional landscape analysis, because this hadn't been done before, probably also because of the high diversity in the health systems here.